Hey guys, welcome back to Care Zone. It's nice to be with you once again. Here on Care Zone, we discuss health issues and give you health information that helps you to live the best quality of life in good health. And today is not an exception. So welcome, sit back and relax while we talk about a health issue that affects almost every one of us. Today we'll be talking about diarrheas and how to manage or treat them, both in adults and children. When people have diarrheas, some will say they're having runny stomachs. Some will say they are purging. Those are familiar statements or phrases that are used to refer to diarrhea in our community. Diarrhea is the passage of loose or watery stools 3 or more times a day or more frequently than is normal for an individual. Now I'm talking about what is normal for an individual because naturally some persons make bowel movements 2 or 3 times a day. But when something abnormal is happening, it is easy to spot it. If you're someone who does bowel movements just once a day, you can begin to sense that there's something wrong when you start making bowel movements 2 or 3 times or 4 times in one day. So when one is having loose or watery stools more frequently than is normal, or at least more than 3 times in a day, then we can term that as having diarrhea. So now, what are the causes of diarrhea? What are the various reasons a person could have diarrhea? One of the reasons is intestinal infection with a bacteria, a virus, or a parasite. Other causes of diarrhea can be drugs, alcohol abuse, cancer-related issues, poor digestion or absorption, irritable bowel disease, and lots more. When a person has diarrhea, the person would have watery stools accompanied by abdominal pain, body aches, sometimes fever, bloating, and when there are serious underlying conditions, it is possible to also have pus or blood in that stool, and there can be persistent vomiting and dehydration. Actually, all diarrheas can lead to dehydration, but it could be more serious where there is watery stools along with persistent vomiting. The rate of dehydration will be much higher in such cases. So how can diarrheas be treated? Normally, diarrheas should resolve within a few days, say 2 to 3 days. A diarrhea bout should resolve itself just with you rehydrating yourself with water, some other fluids, or with oral rehydration salts in order to replace lost fluid and electrolytes. But in more serious cases, it may be necessary to find out the underlying cause, and that would require going to the hospital and getting some tests done. So it may be necessary to do a full blood count, it may be necessary to do a stool test, or other tests that may be recommended by your doctor. And this applies to cases where the diarrhea is persistent, severe, and refuses to resolve or to go away. In children, zinc supplements along with oral rehydration salts can be used to reduce the severity, frequency, and duration of the diarrhea. Adults may use loperamide or bismuth salicylate to reduce the frequency of these bowel movements. Reducing the frequency and severity is very important because it will help to reduce the rate of dehydration, as there is constant loss of fluid from the body when there is diarrhea. If the diarrhea is caused by an infection with a virus or a parasite, stopping the diarrhea too early could retain those pathogens within the body. So it is necessary not to be too fast about stopping the stool with these medications I have just mentioned. Sometimes it is good to allow diarrheas to resolve themselves. It could just, let's take it as the body's way of cleansing itself. And if the diarrhea is as a result of the side effect of a medication you are using, reporting this to the doctor will also help them to know if it may be necessary to switch your medication to another one in order to help relieve you of this side effect. When a person has diarrhea, certain foods can make the diarrhea even worse, while some other foods can make the person start feeling better. For example, if you have a diarrhea, it is necessary to take foods like oatmeal, dry crackers, lots of water, bananas. All of these would help to begin to thicken the stool gradually. And what are the foods you should avoid when you have a diarrhea? You should limit your intake of soft drinks, sugary drinks, and sugary foods generally. Dairy products, honey, dates, these ones contain a very high level of fructose, and their effects could increase the severity of the diarrhea. Not that they are bad foods, but they may not be so good for you at that moment when you are undergoing this diarrhea bout. It is also important to avoid everything that contains artificial sweeteners. These are not good at this time. So since we have said that diarrhea is something that can resolve itself within a few days, how do you now know when you should go to the hospital? One of the danger signs to look out for that should tell you that you need medical attention is when you have dark urine, dark bloody stools, high fever, severe lower belly pain, confusion, rapid heart rate, and if your diarrhea occurred immediately you return from a journey to a different location from where you have always been. So what are the things we can do to prevent diarrheas, both in adults and children? It is very important to prevent diarrheas because diarrheas can cause dehydration, and dehydration can lead to death, and it is very serious, especially when it occurs in children. So what are some of the things we can do to prevent diarrheas? We need to pay proper attention to the things we eat. You know, like we said earlier, diarrheas are caused by, or can be caused by, infections, and we can only get infections from what we have taken into our bodies. So it starts with ensuring that our hands are clean all the time. Regular hand washing is very important. Fruits and vegetables should be washed very clean with plenty of water, and some people like to use salt. Some use hypochlorite to disinfect their fruits and vegetables. Whatever your choice is, the goal is to ensure that before consumption of any fruit and vegetable, that we are confident that that fruit is clean. We also want to ensure that we eat only food that is hygienically prepared. We don't want to eat foods that houseflies or other insects have perched on. These would transmit those parasites that can finally get into the body and cause infections and diarrhea. We also want to ensure that we are taking water from trusted sources. We don't just want to drink any water. We want to be sure that the water we are drinking is one we are confident that it is clean and from a trusted source. And this also applies especially when we are traveling to other areas where we have not been staying. It's important to locate or find out where you can get trusted sources of water for drinking and for cooking. Hand washing is not only restricted to adults. Children's hands should be washed. If they are very small, we can help them wash their hands, especially when they have gone out to play and they're just coming back. Then the bigger children can be taught to wash their hands regularly. Like I always tell my children, once they come in from outside, they are going directly to the tap to have their hands washed with soap. I know they end up wasting my soap, but I am able to achieve that, which is clean hands. So they have gotten used to that culture, and that is the same culture we should imbibe in our children and every other member of the family. This is one way to protect ourselves from infections that finally would cause diarrhea and dehydration. So we have discussed the causes, the treatment, and prevention of diarrhea. Please put these things to heart and protect your family and yourself. Diarrheas can cause dehydration, and dehydration can lead to death. And like they say, prevention is better than cure. And if you have a severe case, you should report it to the hospital so that you can get medical attention very fast. Till I see you in my next video, continue to stay safe and stay healthy. Bye.